about this committee is that we like to hear what each other has to say. Mr. Cummings, you're recognized.
Mr. Gendernart, is that pronounced right?
Yes, sir.
I think you're saying what I'm feeling. I just want us to have an effective and efficient system that also has an element of empathy. The president used to talk about, and I guess he still does, a society where we have an empathy deficit, because we can put all of the rules and regulations in place, but if we don't have people in those places that see people as more than a number or more than a statistic, or not worrying about a bonus over the life of a person, it won't make a lot of difference. But I want to go to, so I agree with you, Mr. Potter. What is it just puts you in the place in your old position, and somebody walked into your office and said, Potter, we got a problem. Those folks over there on Capitol Hill, they've come up with this thing called a public option. What do we do about that? In other words, I'm trying to figure out. I hear the insurance companies on one hand say that they're worried about not being able to compete, but on the other hand, saying that there are certain things that they have to have well, the first thing they don't want is a public option, and I'm just kind of trying to figure out what would be the concerns. What are those concerns? And then I'd like to hear from you, Ms. Spina, also.
Yeah. Oh, actually,
and are they legitimate?
Well, the insurance industry actually has had this concern, has been preparing for opposition to the public plan since before Barack Obama was elected president. And I was there during a lot of the meetings in which we reviewed every presidential candidate's platform for healthcare reform. And as you probably know, President Obama, Senator Clinton, and Senator Edwards all had the public option as a central component of their campaign platforms. So the industry had a long time to develop a strategy to try to oppose that. And what we're seeing now is it being carried out. And they've been saying the things that we've been hearing that make no sense, that it'll put them out of business because it'll be run too efficiently, on the one hand, or that we should oppose it because it's a government-run system. They want to try to defame it and make it seem as if this is a government takeover of the healthcare system. Those are the terms that they use. That's part of the strategy that was developed a long time ago. It's been an evergreen phrase that works for them every time there's an attempt to reform the healthcare system. What are they afraid of? They're afraid of having something that might take a little bit of revenue from them. If there's no public option, and if you have an individual mandate, look what happens. Everybody has to buy their product. And if a person can't afford that product, then you and I and other taxpayers will have to pay the subsidies. And those subsidies, the premium dollars that the people will pay and the tax dollars that subsidize them, will flow right into those for-profit companies, or all those companies for that matter, and then a lot of that will be taken away and go into shareholders' pockets. That's what they don't want to have another competitor. They've been consolidating for many, many years, taking the small players out, gaining control of markets and market share. So of course they're going to try to oppose anything that would compete with them, but certainly anything that they could operate more efficiently.
When I hear the insurance companies say, we're ready to come to the table, we'll get rid of the pre-existing conditions, we'll get rid of the rescissions, and they go through all of that, it makes it sound as if they're basically admitting that this stuff is wrong.
Oh, absolutely. And they said exactly the same thing in testimony before Congress in 1993, and I can point you to it. They know that's wrong. But after the plan failed, the Clinton plan failed, did you see them coming here to Congress and ask them to change the laws? No, of course they didn't. They have thrived. They've made tons and tons of billions of dollars with the system that we have now. They're not sincere. It's just rhetoric. They would agree to it if they could thrive in a system in which these things are made illegal, but they know how to make money. It's kind of like squeezing a balloon. You could make them do certain things. You can regulate them, but what you would have is pressure from Wall Street to figure out ways, unique ways for them to deny care or to shift more of the financial burden to consumers.
Is there any, without a public option, do you see any way where we can control costs? In other words, costs of premiums going
In a
up?
word, no. In 2 words, absolutely no.
Absolutely. Can I just hear from Dr. Pino, just real quick? I saw she was just getting all excited.
Gentlelady may respond briefly
Thank
to
you very
Mr.
much, Mr. Chairman.
Cummings. Go ahead.
Thank you.
Please go ahead, Dr. Pino.
Well, in your general question about why they would oppose the public option is because I think, and Mr. Potter referred to them as a cartel, and it's a cartel that works with very secret, hidden practices that suddenly would possibly be disclosed if they had to compete with a real competitor. So all of these methods, these secret, hidden methods for profit maximization would become more public. And you know, they could come to the table and they could say, oh, well, we will give up pre-existing conditions, we'll give up rescission, but that's only because they have so refined all of the other methods behind the scenes. And I see this in case after case after case where I've worked as an expert witness where, you know, after, all of the labor of finally getting documents that have to be compelled by a judge, and we see the inner practices. You know, these systems are so refined. I mean, they could give up these other things and still have the methods to maximize profits. That's why they no longer worry about possibly having all of these other persons who are uninsured, because they now can control the cost of the people who are going to be costly. You know, it's a process that's been refined over the past decade in ways that are just unimaginable and would take, you know, days to explain how all these devious methods work.
Thank you very much.